Hi, I'm Dr. O with NCLEX Bootcamp. Today we're talking about cold, flu, and allergy medications. From antihistamines to decongestants, we're breaking down the most testable NCLEX points. All right, so here's our roadmap for this lecture. We're covering 4 major classes, which include antihistamines like benadryl, antitussives like codeine, decongestants like Afrin nasal spray, and some key respiratory vaccines. Now you'll notice that many of these medications are over the counter, so that makes them safe, right? Well, not always, and it really kind of depends, which is why patient education is so important with these medications and why it's likely to show up on the NCLEX. So let's start with our antihistamines, and the big NCLEX takeaway here is sedation. So let's talk about why. So antihistamines are divided into first generation and second generation drugs. First generation antihistamines like diphenhydramine and hydroxyzine are sedating, whereas second generation antihistamines like loratadine and cetirizine are non-sedating. These are our non-drowsy allergy medications. To understand why this is, we need to take a look at our mechanism of action. So all antihistamines work by blocking H1 histamine receptors. This means that the allergy message can't get through, which prevents allergic symptoms like itching, sneezing, and hives. Now, the difference comes down to where the drug acts. So first generation antihistamines can cross the blood-brain barrier, which is why sedation is a major side effect. And because of this, we teach clients to use caution with activities requiring alertness while taking these medications. Second generation antihistamines do not cross the blood-brain barrier, so they can relieve allergy symptoms without significant drowsiness. So these are non-drowsy allergy meds like cetirizine. In addition, first-generation antihistamines are more likely to cause paradoxical reactions, especially in children and older adults. And this means that instead of sedation, we're going to see restlessness or irritability, which is a classic NCLEX twist. And finally, anticholinergic side effects are primarily seen with first-generation antihistamines as well. So it's common to see side effects like dry mouth, blurry vision, constipation, and urinary retention. Speaking of anticholinergic effects, this topic deserves its own discussion because the NCLEX loves to test on it. And the cause is pretty simple. Anticholinergic effects occur when acetylcholine receptors are blocked, hence anticholinergic. Now, in other words, we're blocking the communication system of the parasympathetic or rest and digest nervous system, which leads to drying effects throughout the body. So those drying effects are going to present as dry eyes or blurry vision, urinary retention, dry mouth, and constipation. So to remember this is easy because we just need to make it rhyme. So we can't see, can't pee, can't spit, can't poop. Also, we need to keep in mind that confusion is also a common anticholinergic effect in older adults. Now, there are several drug classes that are notorious for causing anticholinergic effects. So to remember these, think these agents affect acetylcholine. So that's going to include our tricyclic antidepressants like amitriptyline and nortriptyline, our antihistamines, first generation like diphenhydramine, antipsychotics like haloperidol and olanzapine, where we often see anticholinergic side effects used as distractor options. So on the NCLEX, don't confuse anticholinergic effects with signs of a life-threatening reaction to antipsychotics like muscle rigidity or fever. And finally, we have our antispasmodics like oxybutynin. So this is all well and good, but of course we're most concerned with how this is going to show up on the NCLEX. Well, first we need to know who should not take anticholinergics. So if the NCLEX asks you about this, look for the client with narrow angle glaucoma because anticholinergics will increase intraocular pressure, making glaucoma worse. Next, we might see a question related to urinary retention. So the best thing that we can do here is to monitor for bladder distension and difficulty voiding. Dry mouth is also common, so if you're asked about appropriate interventions, look for the options with sugar-free gum or candy because this helps to stimulate saliva production without overloading the client on sugar. Constipation, of course, is another NCLEX favorite, so whether it's from an anticholinergic medication or some other cause, encouraging adequate fluids and fiber are helpful options. And finally, we want to avoid anticholinergic medications in older adults whenever possible, because remember, these can cause confusion, which increases the risk for delirium in falls, which is a big safety concern. All right, it's time for our first NCLEX quick check. Take a minute to pause and see if you can answer. All right, first up, true or false? A client with narrow angle glaucoma can safely take diphenhydramine. That is false. Diphenhydramine's anticholinergic effects can increase intraocular pressure and worsen glaucoma. Next up, a client taking haloperidol reports a dry mouth. Which intervention is appropriate? Should we report this finding to the healthcare provider or offer the client some sugar-free candy? Remember, haloperidol is an antipsychotic, which we know can cause anticholinergic effects. So dry mouth is an expected side effect of these medications and can be managed with supportive care like sugar-free gum or candy. All right, our little anticholinergic side quest is now over and we're moving on to antitussives, which are medications used to suppress the cough reflex. Now, the big NCLEX focus here is who should and who should not take these medications. So let's take a closer look. So we have our non-opioid antitussives like dextromethorphan and our opioid antitussives like codeine. Now their mechanism of action is fairly straightforward. They suppress the cough reflex. Now we're going back to that key NCLEX concept of who should and who should not take antitussives. So we need to remember that antitussives are indicated for a dry, non-productive cough. We avoid use in productive coughs, meaning that if a client is coughing up mucus, they should not take antitussives because if we suppress a productive cough, all that mucus is going to stay in the lungs instead of being cleared, which can easily lead to infection. We also need to remember that just like a lot of other medications, antitussives can cause drowsiness and dizziness. So again, we advise caution with activities requiring alertness like driving while they're taking these medications. And finally, we need to remember that codeine is an opioid, which means it causes central nervous system depression, and this includes respiratory depression. So the same safety teaching applies here, and we use extra caution in clients already at high risk for respiratory depression. This is going to include our older adults, clients with COPD, and those who are taking other CNS depressants like benzodiazepines or alcohol. All right, we're moving on to decongestants, which can clear a stuffy nose fast, but if you use nasal sprays for too long, they can actually make congestion worse. So our NCLEX focus here is the 3-day rule. Common examples in this class include systemic decongestants like pseudoephedrine, and nasal sprays like oxymetazoline, which is Afrin, and phenylephrine. Now, these medications work by causing vasoconstriction of the nasal blood vessels, which reduces swelling in the nasal passages, thereby relieving congestion. But first, we need to remember that decongestants cause vasoconstriction by way of central nervous system stimulation, which means they can also increase heart rate and increase blood pressure. So before giving them, it's really important that we assess clients for uncontrolled hypertension and cardiovascular disease because decongestants can make these conditions worse. And if a client reports things like palpitations, tachycardia, or dizziness, this needs to be reported to the provider. Okay, now we're circling back to that 3-day rule because this is a classic NCLEX test point. So clients must be taught to limit the use of nasal sprays to no more than 3 days to prevent rebound congestion. And this is where the nasal passages actually become more congested once the medication wears off, which creates a cycle that is really tough to break. And finally, keep in mind that decongestants are often combined with expectorants like guaifenesin. So if you see this medication on the NCLEX, remember that the big testing point here is to encourage fluid intake to help thin out those secretions and improve clearance. All right, let's wrap up with our key respiratory vaccines. And this is where age and risk factors really matter on the NCLEX. For example, the pneumococcal vaccine is recommended for adults over the age of 65. So there are 3 key respiratory vaccines that the NCLEX expects you to recognize. The first is the influenza vaccine, which is recommended annually, especially for high-risk individuals like older adults, those with chronic conditions like COPD or asthma, and those who are immunocompromised. Next, we have the pneumococcal vaccine, which helps protect clients from bacterial pneumonia. Now, this is recommended for adults over the age of 65, as well as younger high-risk clients like those with chronic lung disease like COPD, or those who are immunocompromised like with HIV. And finally, we have the COVID-19 vaccine, which is recommended to reduce the risk of severe illness, hospitalization, and death, especially in older adults, and again, our high-risk populations. So if you see this one on the NCLEX, be sure to keep in mind that this is a preventative safety intervention. It's not a treatment. All right, it's time for our last NCLEX quick check. Take a minute to pause and see if you can answer. All right, first up, Antitussives are indicated for a productive or non-productive cough. They're indicated for a non-productive cough because remember, suppressing a productive cough can cause mucus retention and worsen the risk for infection. Next up, true or false? Clients with cardiovascular disease should be cautioned about using decongestants. That is true. Remember, decongestants cause vasoconstriction by way of CNS stimulation, which can increase heart rate and blood pressure. And this makes them risky for clients with cardiovascular disease or those with uncontrolled hypertension. And lastly, nasal decongestant sprays like oxymetazoline should be used for no longer than how many days? We need to remember our 3-day rule because using nasal decongestants for longer can cause rebound congestion. This leads to worsening nasal congestion and medication dependence. All right, that covers cold, flu, and allergy medications on the NCLEX.